Well, today is Martin Luther King Jr. Day, and Dr. King once said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. While healthcare inequity was brought into the spotlight during the COVID pandemic. And here to talk more about this, Hartford HealthCare's action to reverse that trend is Vice President of Health Equity, Diversity, and Inclusion for Hartford HealthCare, Sarah Lewis. Sarah, thank you so much for joining us today.
Thank you for having me.
Well, let's first start out with some of the steps Hartford HealthCare is taking to bridge this gap we're talking about.
Thank you so much for raising awareness about this issue, Mackenzie. I just have to say that this topic is a heavy one for all of us who work in this field, looking at these numbers day in and day out, knowing the reality of them personally and professionally. It's taxing. So thank you for bringing attention to it because it's something that we need, not just the people who are Black and Latinx who have been disproportionately dying from COVID at rates that are 2 to 3 times higher than that of white people, to take this seriously, to focus on it and do everything that we can to mitigate this disproportionate burden. Our approach has been an all hands on deck approach at Hartford HealthCare. From day one, we knew that we had to treat this pandemic like a crisis and not assume that everyone had the same resources or access to combat it. So we've stood up testing operations, both permanent and local around the state, and listened to our community leaders and local officials about when and where our services are most needed.
Can you talk a little bit about the perception when it comes to medical care and how Hartford HealthCare is working to change that as well?
Yes, of course. There are instances where people who have experienced systemic racism, not just in healthcare, but in all sort of walks of life, maybe when they're going to get a bank loan or they've gotten disproportionately affected by law enforcement, interactions with law enforcement, they can take these interactions over the course of time to mean that any interaction with a large institution is going to end up with them getting the shorter end of the stick and they feeling as though their lives may not matter. And so we have to combat all of that in healthcare, and people may be bringing that with them, even if they haven't experienced it in the healthcare setting. And then, of course, there's research on the way that people have been treated as a result of medical studies that have caused disproportionate harm to Black and Latinx populations. So we have to internalize that, understand that our patients may be coming to us with that, meet them where they are, and then build our trust with them over time and build that trustworthiness so that they know that we're not part of the system that's going to perpetuate or create any harm.
And you were just talking a little bit about how this pandemic has truly affected some of our communities. We're talking about our Black and Hispanic communities. What would you say to someone who may be skeptical about getting the COVID vaccine?
That's a great question. So I would say that first and foremost, curiosity is great, especially when we're talking about something that's being put into our bodies. And it's good to want to know information about that. And if you're a little bit skeptical, that's fine. What I am so excited to say is that these vaccines are safe and effective, 95% effectiveness. And just having access to these a year after this pandemic emerged is truly remarkable. The science and the research behind these vaccines has been in development for at least a decade. So that's why we're able to roll them out so quickly. So if you're skeptical about the timeline, the research and science behind it is very solid. I got my first dose of the Moderna vaccine. I'm grateful to be able to have gotten that as a healthcare personnel about 8 days ago. I feel great. I get my second dose in early February, and I want everyone to get this vaccine, Mackenzie. I really do. I want us all to be safe and healthy. I want us to be able to hug the people we love most in the world. If we work together, we can all make it happen.
Absolutely. Couldn't agree more. Sarah, thank you so much for joining us and taking the time to talk with us today.
My pleasure. Thank you.